All right, welcome everyone. If you're in anesthesia or critical care training, you know how crucial managing acute coronary syndrome is. Today, we're not just going to look at another paper. We're going to unlock a really powerful study blueprint that can make a huge difference in your exams and, more importantly, in your clinical practice. So, let's just dive right in with a scenario. Picture this. Your patient has chest pain, the clock is absolutely ticking, and every single decision could mean life or death. I mean, this is the moment, right? The one you're always preparing for? So what's your move? You know, the key to handling a situation like that, it's not just about memorizing facts. It's about having a solid, structured approach. And that's what we're doing today. We're going to break down a resource that gives you the perfect blueprint for exactly that. So what is this magic resource? Well, it's Anesthesia Tutorial of the Week 562. And I know, don't let that name fool you. This is not just another dry academic paper, trust me. Think of it more like a battle-tested roadmap, you know? It's designed for people like you, trainees, critical care teams who need to act fast and act right. And look, this quote right here, it gets right to the heart of it. This thing isn't just about theory. It's about those gut-wrenching decisions you have to make right there at the bedside. It's all about knowing when to escalate care, when to make that life-saving referral for revascularization. It's about making the right call and making it now. All right, let's start building this blueprint. Because before we can even think about managing ACS, we have to be absolutely crystal clear on what it even is. And that's exactly where this tutorial starts, right at the fundamentals. Okay, so first up, the tutorial lays out the latest internationally recognized definition of ACS. And look, this is not just about getting the words right. In an exam, nailing this up-to-date definition, that's what shows you really know your stuff. And it doesn't stop there. It also clarifies the modern definition of MI. You know, the diagnostic criteria, they've changed over time. And this guide makes sure you are right up to speed. And that is absolutely crucial for an accurate diagnosis. Okay, so we've got the definitions down, but how do we actually spot ACS in a real patient? This is where things get really practical. The tutorial literally unpacks the essential diagnostic toolkit you've got to have. And honestly, this is where this resource is just brilliant. It doesn't just go over the classic ECG patterns you've seen a million times. No, it dives deep into those subtle, atypical patterns, the ones that are so easy to miss but can be just as deadly. For you, as a trainee, this is gold. This is the stuff that can be the difference between getting it right and, well, missing a huge opportunity to help your patient. Okay, so all this diagnostic work, all this knowledge we're gathering, it is all funneling down to one single critical decision. And it's a decision that you, as part of the team, are going to have to make when the pressure is on. The whole point of this tutorial, really, is to help you answer one single question. What is the ultimate goal here? Every single thing you do, from the patient's history to that tricky ECG, it all has to point toward this one goal. And this is where the tutorial gives you this really simple but super powerful framework. It boils it all down to just 3 core questions. 1, is reperfusion even required? 2, if it is, how are we going to do it? And 3, and this is the big one, how fast do we need to move? That's it. That's your checklist for making the right call when it really counts. So there you have it, right? A powerful, focused way to think about ACS. So let's make sure you can actually find this day. Okay, here are all the details for the tutorial we've been talking about. Seriously, pause here, take a screenshot, whatever you need to do, get this into your study notes. If you're serious about mastering ACS, this is a must-read, no question. All right, so now you have the blueprint. The question is, what are you going to do with it? Are you going to go back and really master those tricky ECG patterns? Or maybe dive deep into the latest reperfusion guidelines? It's up to you, but one thing's for sure. Your next study session just got a whole lot more focused.